Hello, Dr. Jones, back with you again, this time to talk to you about drugs and how drugs influence neural firing. And so this is relevant to both illegal classifications of drugs, but also those legal drugs that are used to treat a number of different things. So we're going to talk about a couple different things. One is agonists, antagonists, and then also reuptake inhibitors. And so we can understand how all of those work. To do that, we have to review for a second our friend the neuron and how neurons attach to other neurons. So if we look here, here's our neuron on the left, and you can see there we have the cell body and the axons all the way down to the terminal branches. The terminal branches are what are going to release chemicals into that tiny little space called the synapse or the synaptic gap, where they are going to attach to the dendrites of the next neuron. All right, so if we zoom in on this, where the terminal branches connect to the dendrites of the next neuron, you'll see that there's this space, all right, that synaptic gap. So you'll see the chemicals come down the terminal branch, they're released into the synapse, and then they try and attach to the receptor site, the dendrite of the next neuron. Now, drugs are chemicals, much like the way neurotransmitters are. And so there's a couple different ways that those chemicals can work that are slightly different than a neurotransmitter. All right, so let's talk about an agonist drug. An agonist drug is a chemical that is very similar to a chemical that is naturally produced in your body. And it's so similar in shape that it will attach to the receptor site, causing that neuron to fire. All right, so it basically increases the presence of whatever that chemical would normally do. There's another type of drug that's called an antagonist. And what an antagonist does is that it attaches to the receptor site. It's similar enough in shape that it attaches, but it's not similar enough that it makes the neuron fire. So essentially what it does is it acts like a goalie does in any sport, right? It protects that spot from anyone else scoring. So the normal chemicals, the normal neurotransmitters can't come down and attach to that receiving neuron. So essentially it makes that neuron unable to fire. And there are instances where we want to reduce neural activity, for example, in, say, seizures. And so the reduction of that neural activity is a desired goal, and an antagonist drug works. The third type of drug is called a reuptake inhibitor. You'll see this oftentimes, oftentimes you'll see it advertised on TV. You'll hear them talk about SSRI, selective serotonin reuptake inhibitors, and there's some number of different drugs that work based off of this. So here's the way a selective serotonin reuptake inhibitor works. So the neurotransmitter is released into the synaptic gap, right, and it's trying to attach to the receiving neuron. What an SSRI is it comes in, and rather than blocking the receiving neuron, after the chemicals, the neurotransmitters are submitted into the gap, it'll come up here and block the sending neuron, because what happens is oftentimes the neurotransmitters, there's a process called reuptake, where the sending neuron acts like a vacuum and it sucks the chemicals back up into the sending neuron. So a reuptake inhibitor comes in and fills those holes so that it can't suck the chemical back up into the sending neuron. What that does in theory is leave the chemicals in the synapse longer and gives them more opportunities to attach to the receiving neuron. All right, so 3 different things you need to know about drugs and how they work chemically and at a neural level is an agonist drug, an antagonist drug, and then a reuptake inhibitor.